Hi everybody, my name's Paul and this is my instruction project for English 314 and I'm going to be showing everybody how to do an IV. Alright, just a little background information. IV stands for intravenous and they're essentially small catheters placed in the vein. Now this is the fastest way to deliver fluid or medications to the body, and so IVs are typically used for administering fluid or different medications. IVs are essential for critical patients that need fluids or medications. EMTs and paramedics need to be proficient at this skill in order to get them in the field and establish IVs in patients that really need them. The equipment we use for getting an IV involves quite a few different things. On the right there, I have a picture of a typical IV bag, as we'd call them, and basically we just have all of our equipment in one bag. So whenever you're getting ready to do an IV, you would get out your IV bag and open it up and pull out whatever you needed. But typically we use IV catheters. That's the needle and the catheter part that are actually going to go inside the vein. For adults, usually we use about 14 to 22 gauge, and it's reversed, so 14 gauge is the bigger size and 22 is the smaller size. We also use Chucks pads, which are kind of like little little absorbent pads that we can put underneath the arm just in case any blood is spilt. We don't want it getting all over the place. We also use sterile 2x2 gauze to kind of clean up the area if we get any blood around the arm. We use antiseptic solution prep pads. Usually this is either iodine or an alcohol prep pad. We use that to clean the site before we stick the patient with the needle to try to prevent any infection from occurring. We also use tourniquets, which usually are just little like big rubber bands that we tie around the patient's arm in order to restrict blood flow and helps us find the veins a little bit easier, and they'll pop out a little bit to help us get the IV. Tachyderms are, it's a clear plastic adhesive placed over the IV site once we finish with the IV. That's to kind of stabilize and secure the IV, and yeah, it's the IV tubing and a drip set. That's how we get the fluid from the saline bag into the patient. Um, the tape is just to secure the IV to the arm, and PPE stands for personal protective equipment. That's going to be your gloves and your eye protection your own safety. So yeah, that leads us into safety. All PPE must be worn. Another thing to take note is immediately after getting the IV, you want to lock out the needle and place it in a sharps container as soon as you can. And then also, if you're stuck by a dirty needle, which just means any needle that's been into somebody else's body first, you want to make sure you follow your department's protocols and initiate that right away. All right, so setting up for your IV, the first step you want to do is gather all the necessary equipment, like we mentioned earlier. You're going to then inspect the IV solution. So if you have a saline bag, kind of what's pictured on the right there, you're going to check it for expiration, make sure the fluid looks good, there's no leaks or anything like that. Once you've done that, you're going to connect your IV tubing to the bag. You're going to fill the drip chamber with fluid, and you're going to flush out all the air in the tube. Next, you're going to prep your patient. You're going to place the tourniquet around the patient's arm. As you can see in the picture, they have a tourniquet around the patient's left arm up there. Most of the time, we place it right above the elbow. Um, then you're going to select a vein and prepare it, or select a vein, and based on which vein you select, you're going to find the right size catheter. So it's a bigger vein, you can go with a 14, a 16, or an 18 gauge. And if it's a smaller vein, like maybe in the hand, you're going to go with a 20 or 22 gauge. Next, we're going to prep the skin with an antiseptic solution, clean it off to avoid infection. Alright, the next step is going to be inserting the IV. You're going to take the cap off of the needle, and then you're going to insert the needle into the skin right above where your vein is. You're going to go in with the bevel side up using a steady, deliberate motion. You're going to puncture through the skin, and then you're going to continue going deeper into the arm until you note blood return into your catheter. That means you have entered the vein. At this point, you're going to advance the needle slightly, and then you're going to level off your catheter. And what you're going to do is you're going to push the catheter in as you withdraw the needle out. This will also lock your needle out, and at the end you're going to have a small tubing left inside their vein or catheter with just a little hub sticking out. And then your needle will be locked out, and you're going to put that in the sharps container right away. All right, the next step is securing the IV. What you're going to do is you're going to take that tourniquet off, you're going to connect up your IV tubing, open up your saline lock, make sure you get flow from your flow through your IV and flow through your bag. You're going to adjust the flow as necessary, and then you're going to clean up the site a little bit, and you're going to cover it with a sterile dressing and secure it using tape and the Tachoderm like we mentioned earlier. Alright, so just to conclude this video, mastering IVs takes a lot of time and practice. EMTs and paramedics do a lot of extensive training in order to learn how to do IVs and to get better at them. Um, Everybody has different veins. Some are easy to get, some are more difficult. It all depends on the person, and everybody's different. So, um, yeah. And the last thing I was going to say is in the state of Alaska, EMT 2s, 3s, and paramedics are all certified to establish IVs. All right, that's the end of my presentation. Thanks for listening.